Our last evaluation that we'll be hearing about is the encampment outreach, and Lisa Boucher, Sam Young, and Zoe Dodd are the co-leads of that evaluation.
Hi, everyone. First, we really are sad that Zoe is not here today, but I think many of you may know Zoe already as just a general advocate, researcher, and is affiliated with South Riverdale CHC. So I'm Sam Young. I'm a PhD student supervised by Ahmed in Clinepi. I'm also a general internist and addiction medicine physician. So we're going to be evaluating the encampments, which, you know, is a very broad sort of thing to evaluate that we're all coming to learn about together. I think many of you will know that in Toronto, as well as in many cities across the country, we're in a shelter and housing crisis. And then as a result of COVID-19, this led to further issues with people being able to physically distance in shelters, and has then led to some changes that have resulted in encampments coming up in Toronto, as well as other places across the country and in North America. So I think, you know, these encampments have come out of a lack of other places for people to go. And I think we also are going to work and build off of what is found in the hotel site projects, because they are so intertwined and have been affect each other. The encampments, there are multiple. I'm learning about it. I wish Zoe was here. She knows everything about them. But, you know, have really been supported by community organizations and also just volunteers. So I would encourage you all, if you're interested, the Toronto Encampment Support Network is a really great place, and they have a Twitter account to follow. So that's a group of people who have really just community members come together to support the encampments. And this has included things like bringing hand sanitizer when there wasn't available running water, bringing tents, bringing food, supplies, case management. So it's really been a multi-pronged approach on how to support people in the encampments, and really, really led from the community. And so we're figuring out exactly what aspects of this we want to look at, and are trying to kind of capture what is really a bit of a heterogeneous group when we're talking about encampments, and trying to figure out a way to synthesize what's going on. And I'll let Lisa talk more about that.
Hi, everyone. Yes, I'm Lisa Boucher, and I'm co-leading, like Sam said, the encampments evaluation with her and Zoe. And Chris is our great coordinator. If you have any questions or want to join, you can contact her. And then, okay, so I'm a PhD candidate at the University of Ottawa, actually, and in epi and public health. And so just continuing from what Sam was saying, like, I mean, we are just starting to work out all the details. Obviously, as other people said, that will continue with the logic model building and further team meetings. But we plan to talk to multiple stakeholders, quite a few actually, and of course the residents in the encampments, and people who have potentially left encampments, and there's a lot of back and forth, so gone to other places, and who may have been back or are in the shelter hotels, for instance. We may talk to people that way as well. And so we were thinking we would talk to several different groups, including basically there's a bunch of different groups. I think Sam started to say about, there's a volunteer group, there's also health organizations providing outreach services, there's like there's the like privately funded organizations as well, there's the city. So there's all these different groups providing different kinds of outreach. So and also in different encampments. So we're hoping to talk to people from all those groups and residents in the different encampments, and find out though the differences there's potential comparison across those different activities, and we'll ask people about which needs have been met or not met through these different outreach supports, and what challenges were faced in receiving or providing those supports, how those were mitigated, and of course people's future concerns as well, as everything's changing on an ongoing basis. So the sustainability of supports and what new supports people anticipate going forward, especially given that winter's coming. That should be an issue for the encampments in particular. And then, so yeah, like I said, we'll look at needs, people's basic needs, psychological needs, physical and mental health, access to care, drug use and like harm reduction and the overdose crisis. And we talked about some things coming up likely, such as grief and trauma and having to bear witness to suffering. Building relationships or a sense of community is obviously important with this evaluation. A lot of advocacy, given there's a lot of displacement of the encampments, and so advocacy is super important, and the issues around the use of public space and just isolation when people are displaced, for instance. I think that's about it. It's just also going to say that there's very little research that's been done on encampments overall, and then we'll be adding to that as well as the issues of COVID-19, which obviously make sharing indoor space much more problematic. So there should be some really interesting things that we can add there to policy discussion.